everyone, I'm Shikaina Aquino Maranga, and for today's video, I am going to perform applying rigid splint return demonstration. A splint is a supportive device that protects a bone or injury. It helps immobilize an injured limb and keeps the bone in place, and also helps in preventing bone protruding through the skin, soft skin and tissue damage, as well as bleeding. To perform this procedure, first thing to do is to prepare the necessary equipments needed to conserve time and energy. This includes a rigid board and several bandages. Okay, we could use a triangular bandage or any long cloth that can serve the purpose will do. After that, we can now proceed to the next step. We should check first for the scene safety. We should watch out for any unusualities such as unusual noise, sight, odor, and appearances. In emergency cases, it is very important to first assess the scene to ensure the safety of everyone involved, of the victim, of the bystanders, and ourselves. If we fail to check for the safety of the environment, we may miss a probable safety threat that could cause more harm. Next step would be to get the victim's consent. Now, if the patient is not impaired, the rescuer must first receive an express consent. However, if the victim is unconscious, the rescuer may rely on implied consent and perform any necessary procedure that is within our level of training only. Good morning, sir. I'm Shikaina Maranga. I'm a student nurse. I have been trained to do first aid. Would it be alright if I help you?
Okay.
Okay. Now, after receiving patient's consent, next thing to do is to provide support to the injured body area to ensure that it wouldn't move and prevent further damage. If we have other rescuers with us, we could ask for assistance. And if the patient is able to do or is able to provide assistance as well, we could ask him for help. Okay, sir, so this is your injured arm. Okay, please hold it right here. Okay, just to ensure that it wouldn't move and cause more pain and damage. Okay?
Okay.
After providing support, the next thing to do is to check for circulation. It is necessary to assess if blood is still flowing through the body correctly, because in the case of inadequate circulation, the muscle or the organ is at risk of becoming impaired because they rely on effective circulation for steady supply of oxygen. Okay, so sir, can you move your fingers? Okay, can you feel this?
Mm-hmm.
Okay, so your hand is warm and still pinkish. I'm going to check for your pulse. Okay, pulse is present. So I check my patient's pulse. I check his sensation, the warmth of his skin, and color as well. After doing that, I am now going to place an appropriately sized rigid board below the injured body area. Now, this splint will ease the pain by ensuring that the injured limb doesn't move. Okay, we will be securing this splint with the bandages. Okay, sir, so I am going to place this below your injured arm just to ensure that it wouldn't move as we bring it to the hospital. Okay, so please hold it right here. I'm going to tie a bandage around here. Okay, please move your finger here, your hand here. Okay. Okay, and hold it close to your body. Okay. In doing so, we should ensure that we tie the bandage on the splint side to avoid impeding circulation. After doing that, we should perform or we should recheck for circulation. Okay, sir, so can you move your fingers? Okay, can you feel this? Okay, your skin feels warm, hands pinkish, and pulse. I'm going to check for your pulse. Okay, pulse is present. So again, I have checked for my patient's pulse, sensation, color of the skin, and warmth. So all of these are present. And now the only thing left to do is to bring our patient to the nearest hospital so that he can receive the proper treatment for his injury. And that's all for today's video. Thank you all for watching. I hope you have learned something. And please like, please share, please leave a comment, and subscribe to my YouTube channel. And watch out for my future videos.